Hi, this is Dr. Rogini from York Family Chiropractic Care at Holistic Health Clinic. And today we have a guest speaker, so we'll be talking actually about what to do at home to bring inflammation down. And this is Sue Skillins. And Sue Skillins, she's a holistic nutritionist, and we actually work together at the clinic. She uses lifestyle analysis, and she's also a certified holistic cancer practitioner. She'll be talking right now
about fish oil and how it brings down inflammation in the body. But before we talk about fish oil and how it works, I wanted to mention why the quality of the product is important. Fish oils are really beneficial for inflammation because of the double bonds that are in their chemical structure, but they react to air, heat, and light. So if they're manufactured using solvents or heat extraction, that's going to damage the oil. This can cause free radical damage in the body and then causes more harm than good when you're trying to use it for your inflammatory process. When we use fish oils specifically for inflammation, we use a very high EPA. It's specific to every patient and what their symptomatology is. So not self-medicating and seeing a professional is where you're going to get your best results. So blood circulation is always important in bringing down inflammation. Your blood circulating, picking up debris, taking it out of the body, getting the carbon dioxide out of the body, delivering oxygen to every cell is going to help with detoxification and bringing down inflammation. High EPA fish oils also promote the anti-inflammatory prostaglandin pathway. These are hormone-like pathways that are in the body. Some of them will dictate an anti-inflammatory response, but the garbage fats that are in processed bag, box, canned foods promote an inflammatory process. If you cut yourself, that's important to bring that red hot pain swelling to the site of the injury. But on a day in, day out basis, it causes inflammation and it's damaging to the body. So how long we use any given fish oil at what dose depends on the person's unique presentation. We don't use really high levels for a long time because it can be immunosuppressive. So it's something we use to turn the body around, go in an anti-inflammatory pathway, and then bring them down to a maintenance dose.
So this is why I think it's very important to, right, just to make sure that what type of product you're taking and consult with the practitioner. And have you noticed this happening a lot nowadays?
I do. I have clients come in and they've bought fish oil from a lesser source and their symptoms haven't gotten any better because the product isn't doing what they were told it would do. I will only work with professional line product, with companies that test the raw materials coming in, that do batch testing, that do end product testing.
Just to let you know, sometimes too, like I see patients with lots of pain, and even with the adjustment, sometimes I cannot even touch them because they're so inflamed. Sometimes, I think it's very important for them to see you. Tell me a little bit about what exactly it does with the pain.
The fish oils?
Yeah.
Well, they do flip the body into a prostaglandin 1 pathway, which is anti-inflammatory. So typically these people are inflamed before you see them. Sometimes that inflammation is actually the body telling them, don't move this way, don't move that way. And instead of honoring that, people will tend to take ibuprofen, acetaminophen, and just keep on with their life, when actually it's their body telling them to just take a moment and breathe and let the body do what it is designed to do. The fish oils promote the body's innate capability to self-regulate and self-heal. It doesn't push the body past what it's capable of.
So Sue, are you telling me that the first thing a patient should start on is fish oil, or is there anything else they should be on as well?
Well, it depends how the client is presenting. Sometimes if it's a very acute injury, we may bring in other things like curcumin, turmeric, to bring it down very quickly. But the body has this inflammatory response because it's prone to it. So the fish oil is more the foundational piece. But the active curcumin or bio-A curcumin, those are things that I would also use to bring it down. Using capsaicin gel topically can also help with the pain. And how we combine the different products depends on every client.
Just to let you know, I have actually noticed a lot when people are on fish oil and curcumin, actually, they are less sensitive to touch, and it's so much easier to work on them. So it's a huge, huge difference I've noticed as well. But in terms of the dosage and all that, how do you work on that? How do you know how much they need and all that stuff?
Honestly, that's when I use my live cell microscopy. Once I see their blood and I see the membranes around every single red blood cell, if they're not strong, if they don't hold up under stressing of the slide, then I know they're not taking in enough.
Okay.
And that's typically an EPA kind of deficiency. And depending on who they are, their age, how chronic it is, I might go as high as 1900 EPA. You know, a product that's more maintenance might be more 400 EPA.
So how long do you have them on the product itself?
The very high dose, they might stay on for 3 months to make sure that we have shifted that prostaglandin pathway and they are living their life in an anti-inflammatory place.
So again, how do you check that, okay, it has made a change? So how do you confirm that everything has shifted?
Well, we would go over their symptomatology in their follow-up appointments. You would be feeling it when you're adjusting them. They would be reporting to you that they're feeling better. I would look at the blood to see what's happening with the membranes.
Okay. Oh, so you do another life once and
yes, I do it every 2 months actually,
Okay.
because the red blood cells live 120 days. So at that halfway point, I should see significant improvement if they're following the protocol. And then once we get them through that place, it's always smart to continue with a maintenance dose of fish oil, because our fish from the Atlantic, it's largely polluted. From the Pacific, we have the uranium coming over from Fukushima. Our fish just isn't what it used to be. There's high levels of mercury in the bigger fish. So getting your fish oil is harder. And adding a product like a fish oil will ensure that you're getting enough in your diet.
I thank you so much, Sue, for your information. Thank you for inspiring everyone and bringing hope that there's opportunities and there's other alternative ways to get yourself better.
Thank you.
So thank you for listening. So we'll see you next week.